My name is Sarah Tischer, and I'm a clinical pharmacist with expertise in solid organ transplant at the University of Michigan. If you are a kidney transplant candidate, you may be able to receive a kidney from a donor who tested positive for hepatitis C. Agreeing to receive a kidney from a hepatitis C positive donor will increase the number of kidneys available to you and may shorten your wait time for transplantation. I am sure you have many questions about this and what it means to receive an organ from a donor who has been infected with hepatitis C. My team and I hope this video will answer most of your questions, but please do not hesitate to contact us if you have more. At Michigan Medicine, we have transplanted over 20 livers from hepatitis C positive donors into hepatitis C positive recipients. We have also transplanted livers and kidneys from hepatitis C positive donors into recipients who are not infected with hepatitis C with good outcomes. This is our outline for today. We will discuss what is hepatitis C and how is it treated. Why should you accept a hepatitis C donor kidney? What is the likelihood of getting infected from hepatitis C from a transplanted kidney? And what is the likelihood of curing the disease if you did get infected after transplant? We will also cover how we will care for you after receiving a hepatitis C donor kidney. We have prepared another video for you with questions and answers. Please watch the Q&A video after you are done with this one. Before we start, we need to explain who is eligible to receive a kidney from a hepatitis C donor. Potential recipients must meet 3 conditions to be eligible. Your health insurance should cover direct-acting antiviral medications. More specifically, your insurance should cover Mavyret, which is the brand name for the medicine glecepivir/pibrentasvir, or Epclusa, which is the brand name for sofosbuvir/velpatasvir. In addition to having insurance coverage, you must be able to travel to Michigan Medicine for post-transplant clinic visits. You also must be able to comply with medical treatment, take medications as your provider directs, and attend all scheduled appointments and clinic visits at Michigan Medicine. Your Michigan Medicine nephrologist will determine if you are eligible. What is hepatitis C? We also refer to it with the acronym HCV. Hepatitis C is a viral infection that affects the liver. If left untreated, it can lead to slowly progressing liver disease, liver cancer, and death due to liver failure. This image shows a liver and an illustration of the hepatitis C virus. Hepatitis C most commonly spreads from one person to another through direct exposure to contaminated blood. People with a substance use disorder who inject drugs are at increased risk of acquiring and spreading HCV to others. The majority of people who get hepatitis C are unaware that they carry the virus because they do not develop symptoms. In most cases, it is possible to cure hepatitis C with the use of highly effective medications called direct-acting antivirals, or DAAs. Hepatitis C is quite common. About 4 to 5 million Americans have hepatitis C, which means that about 1 to 2 out of 100 American adults are infected with this virus. The rate is higher among organ donors. About 5 to 10 out of 100 organ donors have hepatitis C virus, HCV. How is hepatitis C diagnosed? The diagnosis of hepatitis C virus infection is made with 2 blood tests. The anti-HCV test determines if an antibody to the virus is found in the blood. Antibodies are chemicals released into the bloodstream when someone gets infected. The nucleic acid test, or NAT, determines if a person with a positive HCV antibody test has a current HCV infection, or if they were infected in the past and the infection has resolved. Resolved means that the virus has cleared out of their body. The blood test is very sensitive and looks for the genetic material of the hepatitis C virus called HCV RNA. Let's talk about what the tests mean. If both the hepatitis C antibody test and the NAT test are positive, this means the person currently has the hepatitis C virus in their blood. If the hepatitis C antibody test is positive but the NAT test is negative, this means the person was infected with hepatitis C, but the virus has now been cleared from the body. So why do we use organs from donors who are infected with hepatitis C? The wait list for a kidney transplant is long. Over 100,000 patients are waiting for a kidney transplant. The average wait time is 5 to 7 years. It is estimated that between 5 to 10 out of 100 organ donors have HCV. In the past, HCV-infected organs were directed to recipients who are already infected with an HCV infection. This is no longer the case. In recent years, a new class of medicines called direct-acting antiviral drugs have been very effective in curing HCV. As the number of potential kidney recipients with HCV has declined, doctors have begun using HCV-positive donor organs for recipients without HCV infection. Using organs from HCV-positive donors helps to improve access to transplantation, shorten the wait for an organ, and prevent death from organ failure. By accepting a hepatitis C donor, you may improve your access to transplantation and reduce your time on dialysis. Kidneys from organ donors with HCV infection have been used for over 20 years in the United States, largely for recipients who already have HCV infection. Over 3,000 of these kidney transplants have been completed to date. This graph shows that since 2014, there has been a large increase in the amount of HCV-positive kidney transplantations. Several transplant centers in the U.S. have reported good outcomes when using HCV-positive donor livers and kidneys into uninfected recipients. Recipients who agree to accept a kidney from an HCV-positive donor provide written informed consent immediately before the transplant. They are carefully monitored for the appearance of HCV in their blood for up to 12 months after transplant. One question you may ask yourself is, will I get hepatitis C if I get a kidney from a donor who has been infected? If the donor is positive for both HCV antibody test and the NAT test, that means that they have virus in their blood and are capable of transmitting HCV. If you get a kidney from this type of donor, you will get infected. You will take antiviral medications for 8 to 12 weeks after transplant to treat the HCV infection. If the donor tested positive for the HCV antibody test, but tested negative for the NAT test, there is a 20% chance that you will get infected. That means that 2 out of 10 people in this situation get infected. After the transplant, we will monitor you closely to see if you have been infected. If you have been infected, you will take antiviral medications for 8 to 12 weeks after transplant to treat the infection. How do we treat hepatitis C? Hepatitis C is treated with a group of medicines called direct-acting antivirals, or DAAs. These medications are very effective. When taken as prescribed, 98 out of 100 patients treated with DAAs are cured of their hepatitis C. At Michigan Medicine, we use 2 types of DAAs, Mavyret and Epclusa. If you are infected, you will take one of these, not both. Mavyret is the brand name of a combination medicine that includes the generic drugs glecaprevir and pibrentasvir. We sometimes use the acronym GP for Mavyret. Epclusa is the brand name of a combination medicine that includes the generic drugs of sofosbuvir and velpatasvir. We sometimes use the acronym SOFVAL for Epclusa. You will take either 3 tablets of Mavyret by mouth each morning with food for a period of 8 weeks, or you will take 1 tablet of Epclusa by mouth each morning with or without food for a period of 12 weeks. Both medications have similar mild side effects, which include headache, stomachache, and fatigue. Direct-acting antiviral medications are very expensive. This is why before selecting you to participate in this program, we verify that your prescription insurance plan covers either Mavyret or Epclusa. If you change insurance plans or if there are any changes in your coverage, please inform your financial coordinator as soon as possible. You may have copays with your prescriptions. The exact cost of therapy will not be known before transplant. If you have any concerns about prescription costs, talk with your financial coordinator. If you receive a kidney from a hepatitis C positive donor, we will monitor you closely during the first year to see if you were infected with hepatitis C and need treatment. You will have 6 blood draws during the first month, and then once per month for the first year after transplant. If you develop HCV infection, you will be treated with either Mavyret or Epclusa. Treatment will start after insurance approval is obtained. Treatment will last 8 weeks if you take Mavorite or 12 weeks if you take Epclusa. If you get admitted to a hospital while you are on a direct-acting antiviral medication, make sure to bring them with you. Not all hospitals have them available. While you take DAAs, you will be required to return to Michigan Medicine for clinic visits with your nephrologist. You will also need to have frequent blood draws. The number of clinic visits depends on your particular situation. Some people are seen weekly while others are seen monthly. After therapy ends, you will have 4 blood draws and between 1 to 2 clinic visits over the next 12 months. We take several steps to increase the likelihood of a good outcome after transplanting a kidney from an HCV positive donor. We only use good kidneys. That means that we select younger donors with few health problems other than hepatitis C, and visually inspect and biopsy the kidney to ensure good quality. We also carefully select patients who are willing to receive these kidneys. Before asking you to consent to accept an HCV positive donor kidney, we will review your health status, ability to travel, and ability and willingness to comply with medical care. We also verify that your prescription insurance plan covers DAA medications. All these must be in place in order for the transplantation to be successful. We want to reassure you that participating in this program will not affect your care at Michigan Medicine. Agreement to receive a kidney from a donor with hepatitis C is completely voluntary and not required. Declining will not affect your care in any way. Your decision will not change your place on the waiting list. If you provide written acknowledgement and meet criteria to participate in this program, you will be eligible to receive a kidney from donors with or without hepatitis C. You can change your mind at any time, and at the time of transplantation, you will provide formal written consent to receive a kidney from a donor with hepatitis C. In summary, we hope our presentation today will help you make an informed decision aligned with your personal preferences and situation. We know this decision is tough. There are pros and cons. If you agree, you may receive a kidney sooner. The kidney may be from a hepatitis C positive donor. You may develop hepatitis C infection after the transplant. If you develop hepatitis C, we will treat you with direct-acting antiviral medicines that will most likely cure the HCV infection. We want to emphasize that declining to receive a hepatitis C donor organ does not impact your care at Michigan Medicine. It also does not impact your ability to receive an organ from donors without hepatitis C. Thank you for watching this video. We hope it answered your questions about receiving a kidney from a hepatitis C positive donor. If you have more questions, please call the University of Michigan Transplant Center at 1-800-333-9013.